Hey guys, Dr. Alex here, and today we're going to talk about taping, which can be a useful tool if you have an injury or some sort of painful joint. It's not something that I do in my practice. It's something I've been doing myself though, and it's really something that you can do at home. There's not a significant barrier to using it in terms of knowledge because the risk of doing something bad is almost zero. So we're going to talk about taping today. We're going to talk about how it works. We're going to talk about how it actually works similarly to acupuncture and to making a chiropractic correction to the spine. I'm going to give you a little bit of demo of what I've been doing with my knee so that you can do it at home. And we're going to talk about a little bit of research about how it's useful. So let's talk about taping. So if you've ever had it done before, you might have been told that it does this or does that. And what the research shows is that the tape it's not really able to, say, resist the movement of a particular joint or hold a muscle in a particular way or turn on a muscle or turn off a muscle. It doesn't work that way, and that's because the skin is a fairly frictionless interface, which means that when the skin slides around over top of the fascia and over top of the muscles, there's not a lot of friction, and that if you move the skin, the muscles underneath generally don't move with it. So when you have this piece of tape on your skin, it's not going to be able to move a joint or your kneecap or move a muscle in the way that you might hope it would by applying that tape, because there's just not enough friction between said joint, said muscle, and the surface of the skin that the tape is on. Now, that's not to say that taping can't be useful or it doesn't work, but it often doesn't work in the way that a practitioner might tell you it works. What the research seems to show is that it works through your nervous system like almost everything else that a manual therapist does. Whether we're talking about acupuncture or whether we're talking about making a correction to the spine, it's mainly a nervous system reflex and a nervous system change that you are bringing on or inducing, and that's where a lot of the positive effects of manual therapy come from. So we know, especially in our office, like, we focus almost solely on the nervous system, focusing on the nerves that leave the spinal cord through the spine, making adjustments or corrections to the spine to make sure that those nerves and joints are as healthy as possible. And if that is not enough to stimulate a nerve, say in the periphery, in the leg, in the ankle, and the shoulder, that's where some electro or neuroacupuncture can be really, really useful to help to reset and neuromodulate or make sure the nervous system is as healthy as possible. So that's really what taping does, and it works by increasing what's called your proprioception. Proprioception is your brain's awareness of what's happening in your body. It's the sensation that if you feel like you're going to sprain an ankle or roll over an ankle, the signal goes up to your brain, hey lady, or hey man, you're going to roll over an ankle, correct that. And we know that when people have poor proprioception, whether in their spine, their knee, or the ankle, they're much more likely to suffer an injury, much more likely to have some sort of painful condition or painful problem. And when you put this tape on your skin, it's a lot of surface area on the skin that's going to be stimulating all those nerves. And your skin's going to go, hey brain, something's going on here. I got something on top of me. You might want to pay attention to what's happening here. And it provides some neurological feedback to the brain. The brain's proprioception or awareness of what's happening, say at the knee or the shoulder, increases, and it often improves the quality of the movement. Another thing that it does, without getting too scientific, is it can also reduce pain, because the nerves that come from, say, a joint or from your skin, they will override pain nerves up into a certain point. So let's say you have a slightly painful knee. If you have enough of a pull on either the hair or the skin around the knee, it might override that pain signal and your brain won't feel the pain. Could still be a problem here, there could still be an injury, but your brain might not be able to go, or might not be aware of it. It might be not as strong or not hitting that threshold for the brain to detect, and so if you have an event or you have a sport, it might allow you to play, which is amazing. Still going to have to deal with that issue in the tissue, and if there's some sort of pain in the brain, dealing with any issue associated with the spine and the spinal cord. But the tape might help you. So right now I've been saying I've been dealing with a knee issue, so the issue with the tissue, or the problem, seems to be getting a lot better. It was about 80 or 90% on my bike ride today. But what I did, as much for confidence in my mental health and making sure that I could go through with my bike ride and train, I threw some tape on my knee. So let's talk about how you can tape at home. So I use this stuff called Leuco K tape. There's also a Leuco P. Do not buy the Leuco P. It's very, very good, but if you put it on your skin, you're going to lose that skin. You want to buy the Leuco K or some sort of other tape. To be frank, like, they're all the same. I like the Leuco K stuff because the glue on it seems to be a little bit better. I've never had a rash, and I haven't heard any patients of having any allergies or stuff like that. Now, some people might try to tell you that the direction of the pull or how much stretch or all these funky little patterns matters. I don't think it matters. And I don't think the research backs that up either. And it's not to say that maybe you do a certain pattern or you pull a certain way, you might get a 5 or 10% difference, but it's going to be a pretty marginal gain. If you're a superstar athlete, you might need that marginal gain. If you're me or you, and you want to save yourself some money from going to a physiotherapist or a massage therapist to put some tape on, then you could probably do it at home. The stuff you can buy on Amazon. So what I've done here, I'll show you what I do with my knee. I've got 2 pieces of tape. There's a little layer on the back here that stops the glue. So what I'm going to do with my knee, my idea here is I had some pain on the inside, and what I've been doing is making sure that I'm putting the tape in the area of the discomfort. If you're having some discomfort in a particular area, I would put the tape right over top of it. That's going to hopefully send good signals up to your brain and hopefully get some proprioception and stabilize the area. So let's say that I've got runner's knee or I've got some pain on the inside of the knee. What I typically do is I tear the tape in the middle, and now I'm going to put it on the area that's bothering me. So it's going right on here on the inside of the kneecap, and then what I'm going to do, I'm going to hold it in the area that's painful, and I'm going to give it a tug. I'm not going to stretch it the full amount. I'm going to stretch it about 50%. I'm going to keep it stretched about 50%, and I'm going to wrap it around the kneecap. A couple passes here to make sure that it sticks to my hairy leg, and then I'm also going to hold the middle here where I just was, and then do that same 50% stretch and placing it down here. Whether you stretched it 50%, 25%, 60%, I don't think it really matters, but you'll probably want to give it a tug, anchor it down, and then smooth it out. Because now when I move my knee, I can feel it. I can even consciously, like, oh, there's some tape on my knee. So I know from a subconscious perspective, my brain's going to be more aware. And then, I could leave it at that, but what I typically do, just to provide even more proprioception up to the brain, I'll take the other piece, I'll rip it in 2, I'll put it on the other side of the knee or the kneecap, and then I'll give it that same 50% stretch, anchor it down. It's often good if you're using 2 pieces that the 2 pieces will touch, just so it'll help it stick a little bit longer. You might get a little more life out of it, a few more days. Anchor it in the middle, 50% stretch, and then wrap it around the kneecap. And so whether you can see it on the video, it doesn't particularly matter. I hope you guys got a good view, because frankly, the direction or the type of taping or where it ends up, I don't think it's going to make that big difference. I think putting the tape on alone is going to give you a really good potential bump. It might improve your performance. It might help you with whatever painful condition you're dealing with until you can get in to see somebody like myself or another fantastic corrective chiropractor to help you deal with that. But until then, taping can be a really useful tool at home that you can use to help with your sport or your event that is coming up that you do not want to miss. Now, of course, a caveat, I never believe in band-aiding things. I know this is a problem. I'm dealing with it. I just had a massage. I'm going to get my spine checked tomorrow. I'm going to get my knee checked tomorrow. I've been doing my rehab exercises. But this is just to make sure that I keep my sanity by going on the bicycle, that I feel more confident about it, that it's less painful, which is also really important to make sure that it doesn't become chronic and that my brain doesn't become obsessed with it. And just a really, really useful strategy that you can do at home. So in general, if you have that piece of tape, one thing I might not have shown is you round off the edges. You can plop it down on somewhere that's painful, stretch, and then if you don't know what to do with the next piece, just make a cross pattern. and that will provide some better proprioception to the brain. So guys, if you have any questions about taping, let me know. Not something I typically do in the office, but can be a really useful tool at home. I hope you learned something. I hope this helps you make it through your next run or your next ride, but be sure that if there is an underlying issue, make sure you figure out what it is, and make sure if there's a core problem in the spine and nervous system that could be contributing to it, make sure you get that fixed. So, Dr. Alex, guys, I'm signing off. I hope you have a wonderful day.